So I want to ask, does she love the first two babies more than she loves the third one, for whom she didn't feel any pain?
The relief.
You're like,
The
yeah,
relief.
this is heaven.
Yeah.
Is painless labor a possibility, or do we have to just suffer through labor and delivery? We've always heard about epidurals in movies. We've seen it in the Western world, but can it be done here in Uganda? What is an epidural to begin with? Are there other pain measures, or does it have to be the epidural only? Today we're going to explore the area of painless labor, and I have two doctors with me that are going to answer all our questions concerning epidurals.
Seen a lot of change, been through a lot of pain. Some things are not the same as they were a year ago, but all will be okay. I move on each and every day. The past is where it stays, way back a year ago.
So I have two doctors with me. They're going to introduce themselves, and we're going to talk about this thing called the epidural.
Okay. I'm Dr. Andrew Miedu. I'm an anesthesiologist at Bethany Women's Hospital.
I'm Dr. Patience Atumanya. I'm an anesthesiologist at the Uganda Cancer Institute.
First, who is an anesthesiologist? It's a big word.
Yeah. So, an anesthesiologist is a normal doctor who first study for 5 years to do general medicine, then go back to school for another 3 years to do anesthesia. So, under that, we study about critical care. We're going to run the ICUs and high dependence units. Then we do chronic pain and acute pain. And then we also do obstetric anesthesia, which epidurals fall under.
Yes. So we all know that labor is painful. God said women are going to feel pain while giving birth, and giving birth twice was painful. So what are epidurals? This savior that has come for us.
All right. So, I'll say an epidural is a type of medical intervention that we use to take away pain for patients who are going through, I would say, anything that is painful. It can be a surgical operation, it can be, labor itself. I think that's the reason why we're here. So, the way we do it is you put a needle in the back. Okay? Just below where the spinal cord will end. I know that's one of the things people worry about. And then you put a catheter through, and you leave that catheter in. It's very small, so that we can put the drugs throughout without causing the patient further pain through extra pricks. I know many people will have heard of something they call a spinal, the one we put when we're going through a section, kind of thing. So this is just one layer above. So we don't actually go into.
This one is not similar to the C-section.
No, it's just one layer above it. So when you think about an epidural, I'll try to bore you with some scientific explanations. So you think of you have the bones in the back. Of course, they're going to be together, and then in between there's a space because it doesn't really close completely. That's how we are able to move our backs back and forth. So with the spinal, which is the commonest that is done for mothers going for a C-section, we go through these bones in between and go through the layers until we reach the water which is in the back, what you call the CSF, right? Now, there we wait for that fluid to come out, and then you shua it in, and then you give the drug. Now with an epidural, we go just above the layer that closes off that water in the back. Okay. Once we reach that space, then we thread a catheter in and take out this big needle. The catheter is so flimsy, the patient doesn't even feel it. And then we strap it on the back and keep giving drugs throughout until we are done with that process of labor. So that's, in a nutshell, what an epidural is.
It sounds painful. It honestly sounds painful.
I know. Many people are going to be so worried about it. When you think of going to a dentist, you get that little numbing agent at the gum, right?
Yeah.
So we start with that. We give you a numbing agent. So that's the needle you feel. The rest of the extras, you just feel a bit of pressure, like someone going through something, but it's not painful. So that's how it's done. It shouldn't be painful. Just the initial one, like a mosquito bite. Then afterwards, afterwards you feel pressure, and then we are done.
So, can you also give an epidural to a mother who is going to deliver vaginally?
Yes.
So,
I'll leave that to check.
so yes, so that epidural that she's talked about can be used for several surgeries, including cesarean sections and all. But for this particular talk, we're talking about someone who is going to have a normal vaginal delivery. So we use much lower concentrations than we use for surgery, so that someone can actually deliver normally with it. So what we do is we use a very low concentration so that the person can actually walk all through the delivery,
So they
the
can
labor
even
period.
walk while they're in labor.
Yes, they walk all through the labor and then they push the baby. So since the concentration is very low, they feel the contraction so that they can actually, I don't guess I'm saying too much.
Wow. So if I am terribly afraid of needles, are there alternative pain relief options for me?
I see. So for the most part, I would say so you can think of how do I'm trying to find out what term it's. You'll have the gold standard, which is something that this is
The
what
best,
will work
supreme.
the best, yes. And then you have these other alternatives. Yes, they might give you some relief, but it's not as great as what the best is. So yes, there are some drugs you can give. Things there will be drugs, and then the others, like you've heard of people doing.
I've had of the gas mask.
There's the gas mask, the Entonox. So it's like an anesthetic agent. When you feel pain, put it on, black out through the pain, and then wake up when the pain is done. That, that's one of the things. But it's not commonly available here because of the technicalities with setting up and all that. And then you have the others where you have like drugs, like morphine. But these opioids are not good for the baby because they can easily go through and you deliver a baby who's a bit, who's tired, they're not breathing well. So we try to avoid them as much as possible, especially towards the end of the labor process. Yeah. And then we'll have the other things which are non-pharmacological. And I think Andrew has tried some. Have they worked? I don't know.
Yeah. So for those ones, you can do music. Some people say it helps.
Yes.
Yes, you play some music. That is music therapy. You can have delivery in a bathtub. I don't know which place does that. Do you know it?
I think I know the medical hub said if you let them know beforehand, then they can organize.
I think GMR does that
and
too.
CMR and
Yes.
That's very interesting.
Yes, then you can come with your husband, you can massage your back.
I've been there. It doesn't relieve the pain.
Then there's breathing,
Yeah.
like breathing,
Yeah.
breathe out. You can control at least your breathing, gives you some semblance of control over what's happening
Yeah,
to
I've
you.
done that one.
What else?
Did it work?
The pain is still there. It's just that now I have a bit more control. I just don't want to feel the pain.
So some you will have, I think one of the more commonly what people say works is the therapy, hypnotherapy or meditation. But these are for people who have done it for years and they can actually meditate themselves out of pain.
But
I
it's
don't
also hard to meditate in our labor ones.
Whenever
Everyone is
it's
Everyone
shouting.
else is screaming,
Yeah.
they're checking you.
you can do yoga. There is a yoga ball that you can sit on.
Yeah,
It applies some pressure on the perineum so the pain won't be that much. Yeah, and you can combine all of them.
So I've heard of some situations where the epidural fails and has to be done again, something like that. What causes that? And can I now prepare my mind for a painless labor, then you do the epidural and somehow my body just...
So, we have to first of all define a failed epidural, because in this case, we are doing it to take away pain, right?
Yeah,
So that would mean
I'm still feeling
you're still feeling the pain.
Yeah.
So, We have special needles and syringes that can help us right from placement. You can actually tell that the epidural is in the right place, right? So you have a special needle and special syringe that can actually identify the space. Now, where it's ending up is a potential space. That means it's not really a space. You have, so you can imagine two papers together. So when you push air in there or medicine, it opens up. And the needle can go to any side. It can go to the right, the left, the middle. The idea is for the medicine to cover the whole epidural space, the front, the whole of it. That way, it can take away the pain on both sides. So there are some instances where the pain will be relieved only on one side, but then you just pull it out a bit. Yeah.
So you just have to readjust it.
You have to just readjust it. Have you had any pain with epidural?
Yeah, I've actually had one. So I know you've heard of the ones where you can actually walk into labor. So for some, we are different people, right? Some have lower thresholds for pain, some really have high thresholds, so dosages might change. For those that are feeling pain, then you can go up on the dosage and make sure. So those are ones who might have their legs getting numb because they require higher doses. So that's something you can try. Then those that go on one side, then you might have to actually replace it. You go at a space higher and put another one because the back, you don't know what's there for the most part, and you might have a few webbings or something that this might cause it to be a bit patchy. But you can tweak it around and see how to get a patient an unfailed one.
Why is it that many gynecologists, many that I've heard of, discourage epidurals for vaginal deliveries? They're always on the edge. Even my guy himself.
So I'll tell you from at least where I work. So there are two different specialties. There are the obstetricians and there are the anesthesiologists. So the obstetricians study about the things and they focus more on the negatives, right? So and they get attached to the patient. So if I were your obstetrician and I knew there was a chance of something bad happening, I'd probably push you towards the safer option. But then there is another group, the anesthesiologists, who actually do this, right? So with the many years of practice and the increased number of epidurals, you can actually get to know, you get better, right? And you have less and less complications in that you get more confident doing it. So at Bethany Hospital, most of the patients kept asking the obstetricians about epidurals, and they knew they didn't know much about it, so they asked for an anesthesiologist to be part of the antenatal team. And that's where I do my.
So you come in.
So when we go and sit and actually talk to patients, we tend to, the numbers have gone up because we can actually talk about it more confidently than they would. Yes. I don't know, patients.
Well, I also think it's about the level of training and who's training us. This is a technique that has been in Uganda for maybe about 10 years, right? And anesthesiologists are few. So, you have one person doing like one epidural in a while, and the gyne you're exposed to is just like maybe one. So the rest of the people will assume that it actually doesn't work, yet in actual sense it just does. And I feel like it's more of exposure is one of the reasons why, and also our patient clientele is not empowered to ask the why and push for what they want rather than depending on what the guy wants, yet they might actually be misinformed. So I think it's up to, I can't answer for all the OBS guy, but I think that's what I would say. Maybe one of these days we should ask a guy and see.
We should.
Yeah.
I'm going to ask my guy why he's against it.
Yeah.
So are there side effects? Some people say they get backache. Some people think it causes autism in children. Are there side effects?
I know, let's start with the basic one. People are scared of needles. You are scared of needles.
I am scared of needles.
The first thing they will worry about is the pain. So like she said, we'll first numb the skin where the needle is actually going to pass, right? So you won't feel the pain. So that's all. But you feel only that one Creep. Yes. So the other pain that they worry about is back pain. People associate any form of needle to back pain, those who have had spinals and epidurals. But the back pain that someone has following delivery is usually about the weight that you gain during pregnancy. It's more on the front, so your back is going to sort of bend more, and those bones are going to sort of get distorted. So after delivery, they have to rearrange back to the normal
So
state.
that's the back.
So that is the back pain. It happens to about 50% of mothers, whether they've had a spinal or a normal delivery or an epidural.
I've also had the migraines from epidural.
The post-dural puncture headache, I think that's this.
Oh, okay. So what you said is the layers that the needle has to go through is supposed to end above the one that covers the fluid. So if you go beyond that, you're more likely to have the headache. But when it happens, it's also not, we can foresee it's going to happen, and we can do some things to prevent the headache from actually occurring. But if it does happen, we still give you some few pain killers to actually help you with that.
So if someone experiences the side effects, are there any follow-up measures? Do they follow up with their their physician?
I usually tell all my clients, if you get, we always go through all these things, by the way, before we give you the epidural.
Yes.
We tell you about the side effects that are likely to happen and what to do. If you have a headache after, then we tell you, come back to the anesthesiologist who gave you the epidural, and they will give you the appropriate treatment. And for the most part, for most of them, I would say about 90% of them, it will really need just simple painkillers. And then there will be maybe that smaller percentage who might need bed rest, fluid resuscitation here and there. So most of them are self-limiting. By seven days, for the majority, about 99% is really cleared out.
Yeah.
So yes, follow up with your anesthesiologist so they can manage these side effects as well.
So during, you wanted to add something?
I think we're asked about
Paralysis. Yeah.
Paralysis and getting lame.
getting lame.
It's always interesting. So the ones that have asked surprisingly have not gone through the epidural or the spine. But they just hear all these random stories from fellow mothers and they say, no, if you give this, your legs won't work.
Yeah.
But yes, the legs won't work while we are giving the drugs.
While you're on the epidural.
Yes. And those are only the patients where we are giving even higher doses. If their pain is not as well controlled, you go higher. The legs get numb, same as if you give the injection. It's self-limiting. By 2 hours after we are done giving these drugs, you're back to normal walking up and about. And remember, we said we give these epidurals in spaces where we are sure there's no spinal cord, especially for labor. So there's no way you can get paralyzed. You're not moving your limbs. So that's really a myth. And then he talks about autistic children.
Yes.
The drugs we give in the epidural do not cross the placenta. So there's no association
They won't
between.
affect the baby won't be born tired or sleepy.
No.
So I've had when I was in labor, you can feel the contraction reach its peak and then it's time to push. So now if I'm not feeling pain, if I'm not feeling my lower part, how do I know when to push?
So, like I said, we use very low concentrations. And also, there's a numbing medicine that we put in there. But then there's another medicine called fentanyl, which is also a low concentration. If you add them, it allows you to use less of the numbing medicine. That way, you're not numbed completely, right? So what happens is you feel the contraction. It's not painful. You feel something tense up in the abdomen.
You just feel pressure.
Yeah,
Yes.
you feel pressure, but you don't feel pain.
So you can actually know when to push.
You can know when to push. Yes.
In the movies, I've seen people strapped with those things. Do you strap us also here?
Yes, so the strapping things are they serve two purposes. There is one that monitors the baby
Yeah.
all through the process. It shows you the baby's heart rate
Yeah.
and how the baby is responding to the various medicines that you're giving.
Yeah.
And then there is one that actually shows you a contraction and how strong a contraction is.
And we have those available in Uganda. Guys,
Where have you been
knowledge is
delivering
power.
from?
I would say. I also wanted to know, painkillers are contraindicated with labor. Like it can affect the baby. I visited someone over the weekend and their baby had to be in the NICU because and she had to be put under completely. So the baby I think was sleepy or something like that. So how do you remedy that with epidurals when all babies be born tired and sleepy and
So, yes, there'll be drugs that will give you issues to the babies. Like the opioids, that if we say we are giving them through here, then they can cross and go to the baby, the placenta. But the ones we give, like we said, we put it in the back. It's just blocking off the nerves themselves from transmitting pain. It does not cross over into the circulation to be able
so
to
it's
go.
just in the nerves.
Yes,
Yeah.
it's a localized thing.
Since the needle actually ends in the epidural space, where that medicine is supposed to work, there is very little of that medicine.
Yeah.
And it's broken down very fast. So if I give you one shot of the medicine,
Yeah.
in the next 30 minutes you would actually be feeling pain. So it's broken down that fast. So it won't cross over.
Okay.
Yeah.
And then one of the other uncomfortable things of labor is the cervical check. What solution do you guys have for us?
Maybe do.
So at what point during labor can I get the epidural?
So when we have, this is where we grade it at the labor itself. So with the cervix, which is the opening to the womb, so it opens up from 0 to 10 centimeters. Huh?
Yeah.
For those that know.
Yeah.
So there is 0 to 4, which is latent labor, then 4 to 10, which is active labor. So for most first-time mothers, place it at 4 centimeters because we know once
At
you
4
reach 4
centimeters,
centimeters, yes, you're actually going to
Feeling it.
you're going to progress to 10. You can have false labor. Have you heard of it?
Yeah.
Where you have a contraction and then somehow they disappear.
Yeah.
Yes. So it can happen anywhere from 0, 1, 2, 3. So once you reach 4, we know you're going to progress all the way. So we place it at that point. Then we have those who are being induced.
Yeah.
Yeah. They say the baby has overstayed and they are giving you some artificial things
Medicine
to
to
cause,
increase. Yeah.
cause the contractions. So once you start feeling pain, it's placed.
Can I walk when I have an epidural? Because you know they tell you during labor you have to keep walking.
A yes and no kind of answer. For the most part, if we give the low concentrations and your pain thresholds are not,
Hi.
we can actually maintain you with a walking epidural, where you can walk with your catheter. It's very flimsy. It's like having a cannula, but
It can come out.
No,
We take it.
we tape it really nicely, and so you can do your movements and you're fine. But in a circumstances where we have to use higher doses, then they might make your legs a little numb, or you feel a bit wobbly. So we try not to allow you to walk. You stay more in bed, but that's more towards the end or towards the delivery where the contractions are stronger and the pain is a lot worse. So yes, you can walk, but though sometimes that might not be.
Short labor.
So if I have an epidural, does it guarantee that I'm going to have a normal delivery?
Oh, okay, that's a nice question.
Yeah.
So someone asked me if you would refund their money if they end up having a cesarean section. So where I work, we try to. So you don't just come and ask for an epidural and we do it. So there are things that we go through. So we would like to give it to someone who is most likely to have a normal delivery. So
How do you tell?
so it's a team. So the obstetrician will check and see if the vaginal exam, which you don't like, to see if the baby can
No one
actually
likes it. No one likes
if the baby can actually pass, then the baby, maybe the head should be coming fast. There is no hold around the neck. It's not lying, funny. Yes. So we choose those who are most likely to actually have a normal delivery. so that you can at least, because it's an extra expense.
Yeah.
So we wouldn't want to do it for those who are pretty going to have cesarean sections. However, labor is unpredictable.
It is.
So if you end up having a cesarean section, for many reasons, could be fetal distress or something, we can still use the same epidural to actually anesthetize you. We just give you a larger concentration so that you can safely take out the baby. Yes.
So if I have that catheter in my back, can I still give birth lying down, or now we have to find other positions?
No, you can still give
I
back.
can still lie down.
Because we really put a nice adhesive tape that makes it not go.
Doesn't jump out.
For some, we even leave them for 3 days. Not the labor ones, but the other patients who are doing surgical procedures and it still doesn't go out.
Yeah.
But like we said, labor is labor, and it's like, say, if I don't give you an epidural and you go through labor, there are always 2 ways out. It's either a C-section or normal delivery.
Yeah.
So with or without the epidural, it's the same outcomes. Yeah. It doesn't increase it or reduce it. No.
So, Dr. Patience, that 1 million to 1.5, what does it cover?
Okay, so when you're doing these epidurals, you don't place it and go away, right? You place it, you stay with the patient from beginning of when you place it until they deliver, and then wait after they've delivered to assess them, make sure they're comfortable, and then take out the catheter. So if your labor takes 24 hours,
You're there for 24 hours.
the anesthesiologist will be there for 24 hours.
Wow.
So that's why the cost is
For their
is
time.
as it is. Yeah, it's for the time spent. But
And also the things we use.
yeah, and also
Like
the
I said, we
drugs.
use special needles and special syringes, so the kit is quite expensive. The drugs themselves,
Yeah.
and the extra expertise really.
So I can just walk into any of these hospitals and I'll find an anesthesiologist to do this.
So they're not
Which
everywhere.
hospitals? Yeah.
They're not everywhere. But preferably, if someone wants an epidural, what we're trying to do these days is to actually have a review before. Yeah, you don't have to wait for the labor to come, then you start looking for an anesthesiologist, because they work in many places. They do critical care, they do theatre. So sometimes you may actually fail to get someone who's free to come and actually work on you. But if you see them before, they will commit and they can come and see
Just
you.
like your gynecologist.
Yeah, exactly. Yes. So you're more likely to have the service if you actually see someone way before.
So, how do I know that someone is actually trained to do this? Because we know this is Uganda. Someone will just put on a white coat, stethoscope, and tell you, I am your anesthesiologist. How do we know that?
You have to check that.
So that's interesting. Yes, I know Uganda. We are full of.
We're creative.
It's the land of
creative.
dreams. Anyone can be anything.
Yeah.
So what we've tried to do, because we know these are there, and this is something very technical and critical. So we've tried, at least for the main hospitals, for now we are sure there are about 5 hospitals where you will find an anesthesiologist. One of them, say IHK, Nakasero Hospital, Bethany Hospital, Kampala Hospital, TMR. Like we are certain you will find an anesthesiologist and they'll give you the epidural. Now, as an association, we've tried to make sure that we reduce this kind of forgery ongoing.
Quacks.
And quacks and whatever. So we've put up an epidural team. You'll find myself, Andrew, and a couple of others with us. If you get in touch with one of us, even if I'm not available, I can refer you to someone equally competent to give you the same service that I would give. And also, if you check out the website, we are trying to put up a register for anesthesiologists in Uganda who are certified, and they are, you can. So if I tell you I am Dr. Asumanya Patience, check me out, see what my qualification is, rather than taking it by word of mouth.
Yeah.
And also, maybe the last one, we have a call center. We've been using it to help the peripheral referrals, where we have, say, the junior cadres, anesthetic officers, or anesthesia students. So you can use it, goes to our admin, so they can at least verify who the person is. Because we are a small community, everyone knows everyone, so we would easily pick up who's right.
So we have to take it upon ourselves to actually do the research, so we are not first of all, cheated out of our money
And our health.
yeah
I think the best, what do I say? The best medicine to ignorance is exposure. So if someone is worried, say if there's an obstetrician who thinks this doesn't work, it would be nice to give us a call and say, okay, I've seen this not work, and give us evidence. Or we actually call you in.
yeah
We don't mind, we always place the epidurals while the guys are there. So that they can make an informed decision about this rather than taking it from hearsay and saying this doesn't work. So that's as much as I'd say.
So again, it also takes time because this is a new thing. People have reservations when it comes to these new things, including it's a whole team. There are midwives, there are pediatricians, and there are obstetricians, then anesthesiologists, and we are very few. But for you to change the mindset in a particular hospital, you simply have to go, maybe do one nice one, do a second one and a third one and a fourth one, and then some. It's slow, but then everyone starts to change and they'll get on board. So that's what we are doing. We identify hospitals which have open-minded obstetricians and midwives, and then once the team is on board, the numbers actually pick up.
yeah so for every husband who wants their wives to have like 6 kids, this is your solution.
Most patients these days are empowered, right? They read and watch a few videos. So most of the videos out there are by whites
yeah
sharing their experiences.
Yeah.
And I actually decided to also watch some of them because most of the patients I was talking to were so against it until I watched what the content was. And for most of them, the issue was when they had the epidural, they couldn't move, and it was quite uncomfortable. And they had to be carried from, say, the bed to the wheelchair, and then to the delivery bed, and off the delivery bed. Then they had to put a catheter for them as well, so that because they can't feel the urine as well.
So do you have to put a catheter for every epidural procedure?
No. So that happens if we use a very large concentration. So you can't actually feel the urine, you can't feel even the contractions, you can't move. So what we do, like we said, is a much lower concentration, so that you can actually walk, you can feel the contractions, and you can actually go and pee and come back. Yeah. So the numbness, it rarely happens, but if it happens, it's because it's towards the end, and it's because the pain is way too much. So we have to give you a larger dose to keep up with the pain. But it's not like once we put it, you stay in one place all through. No, it's not. That's not the case.
So we've had all these things about epidurals from the doctors. What about if we had from an actual patient? I'll first let her introduce herself. Introduce yourself.
Yeah, so my name is Sandra Bisegera. Sandra Bisegera. A pharmacist and a mother of 2. Yes.
She's a mother of 2 and has had epidurals with both her pregnancies.
Yes.
Do you know what contractions feel like?
Yes. Yes.
Okay, so
Yes, I do.
you do.
Yes.
We're just going to hear her experience, your thought process deciding to get an epidural. People keep saying there are side effects. Some people think you get lame when you get an epidural. Clearly she's not lame, but we're going to have that conversation with her so we can know more about epidurals. First, I want to ask, people keep saying that kids have side effects like autism or I don't know, oxygen deficiency because of the medicine. Do you have any side effects with your kids?
No. I'm grateful to God. My babies are really healthy. Nothing like autism.
So Sandra, how old are your babies, just for context?
Yeah, my eldest is 2. The other is 3 months. Yes.
So I want to know, what was your thought process deciding to get an epidural? Were you just scared of the pain, or what made you?
So when I first got pregnant for my firstborn, my major worry was pain.
Yeah.
So I kept thinking if there's something that can lessen the pain, and I'm grateful my husband had information. So my husband told me about the epidural. And of course, being a new thing, I was a bit skeptical. So I decided to do some reading. And from the information I got, I decided I wanted to do it. Mainly a fear of pain. So when I saw this opportunity, it was an answered prayer for me.
Like, no pain.
Yes.
Now, let me ask, how did your mom react? Or your family members react when they're like, hey, but Sandra, you have changed, or why don't you want to,
Well,
women have
yes,
to go through
yes,
this
yes.
pain?
Yes, you should expect that, given not many people know about it's a new thing, like really. So my mom, I went with my mom to hospital, and my mom, being my mom, she didn't say much about it in the beginning. For my first child, she didn't want to see what was happening. I should say she didn't see. She didn't want to know much about it.
You want to see her daughter in pain?
No. Now that, I think that is what brought her to
Hospital she had come to.
Yes, to help. So when I told her about this, she was taken back a bit, but she didn't fight it. Since I told her it was a pain relief. So for my second child, she was much
more receptive.
Yes. She actually took a video for me to see what had been done. Yes. So in the beginning, she didn't want to know about it, but in the second baby, it was much better.
So have you experienced any side effects now that you have two babies? Backache, any headaches? Some people say they get migraines after epidurals.
Well, I read about that, and I was a bit scared in the beginning. But with my first child, I didn't really get anything. The only thing that I got was itching, which is not exactly the epidural. It's
Itching
the
where?
medicine.
The whole body, or?
It's a general body itching, but it's not the epidural. It's the medicine that is used. Yes. But even the itching didn't last long. I had it for a few hours.
Is this itching during labor or after?
It's after. But it doesn't last long. I was in hospital for a day. By the time I left, I didn't have itching. So really, compared to the pain, I would definitely prefer itching.
And were there any side effects on your babies, like when they came?
And
What's
so
headache?
the headache and backache, none.
No headache, no backache.
For
Wow.
both my babies.
Wow.
Yes,
Would you do it again?
definitely. Definitely.
And I also wanted to ask, at what point, since an epidural numbs you from the waist down, when would you know how to push, when to push?
And you feel the contraction.
You can feel the contraction.
Yes, but it's painless.
Explain.
Like you feel that.
You feel the urge.
Yes, you feel the urge to push, but
you don't feel
there's
that
no
pain.
pain.
That's, you know,
Yes.
for me, with my first baby, I was in labor for 17 hours. And I think it was painful for about, like that intense labor was for about 3 hours. Then with my second child, the intense labor was for about 2 hours. Like that labor where you have to scream, and so I can't imagine just being there.
Actually, for
don't
my
feel
first
anything.
child, when I was in labor, the nurses kept saying, "This is a strange labor ward."
You're not screaming.
I'm
you're
not
not
screaming, and yet we are giving birth. Like it was
It's
that
time to
time,
pull.
yes. But there is no screaming.
Wow.
You feel the contractions and you need to push, but there's no pain. Yes.
Wow. How long was your labor?
For my first child, I induced, but it was done in the evening. So I labored the entire night. Now the epidural was placed in the morning. The relief.
You're like,
The
yeah,
relief.
this is heaven.
Yeah. Then for my second child, Labor was just a few hours. Epidural was placed, and I had to wait for my gynecologist. So that is what caused me to have some pain. But the moment it was placed,
So you needed your gynecologist to give the okay for the epidural.
yes. So there's a team of the gynecologist and the anesthesiologist. Yes.
And they have to work hand in hand.
Yes.
You know, for me, it's really amazing that someone can go through labor and not feel pain.
Yeah, I feel you. It was just heaven, I should say.
Were you afraid of the needle in the back? Is it that painful, that needle in the back?
Not really. Like when they are the first time there's a tinge on the skin, of course. as it's
Like a
being
normal
placed.
needle, like this one for.
Yes. After that, nothing.
So you don't feel like a long needle going into your spine. You don't feel that.
Not really. It's just a bit of pressure, I should say, but it's not pain.
Pressure, like when they are pushing in the medicine.
When they put the medicine, you just feel cold, like as the medicine is. Yes.
Because I'm one of those people who fears needles.
It's just
So
a
I'm always
tinge.
like, how am I going to allow a needle into my back?
Really.
It's not that painful. It's not that discomforting.
Yes. Besides, for my first child, I just kept thinking, when is epidural getting?
When am I getting the
when is it going to be placed? So it was hard for me to focus on the needle.
Just
Even with
wanted
my
the
second
pain.
child, I had started feeling pain. So I just wanted, when is this medicine going to start? So it's hard for me to think of the pain like from the needle.
So is it just a needle, or they leave something in your back?
So they are tubes that they put. Then the medicine goes through to
Into
your
your
body.
back.
Yes.
So how long after giving birth are you able to walk around, feel your legs?
Well, with my first child, I wasn't able to walk for a few hours. But with my second child, I walked to labor.
You walked to labor?
Yes, I walked there.
And then after the epidural, after
I
giving
could
birth?
still walk.
You could still walk?
Yes.
That's amazing. And yet you were not feeling pain? Wow.
I could walk.
Guys, this is the life that I want. This is the life that I want. This is the baby girl life. Sandra, some people say because you haven't felt pain, so you don't know the pain of giving birth, you might not love your kids as much.
Really? You cannot not love your children. Like, I think it's not a valid question for me.
I agree.
Why would anyone think you don't love your children
Just
because you didn't feel pain? No. No.
So there you have it. Epidurals are not going to affect the love that you have for your kids. Sandra, was your gyne resistant to an epidural?
With the first child, he was okay with it. Now the second child, he had some restraint.
Why?
I don't know. Maybe because it's a new thing. Not many people know about it.
Was it the same gyne as the
No,
first?
no.
Oh, it was a new
Different
gyne.
kind. It's
But now, after seeing you giving birth with the epidural, did he
yes.
he
You could
believed?
you could see that it's
The
like
change.
two different people before and after.
So we just have to have an open mind and convince our gynecologist that this is possible. Because I think I want this baby girl life. Sandra, what was your mom's reaction after?
Yes, so after my first child, when we went home, my mom, after the whole saga, like just reached so much to do. But after all that, she told me, Sandra, you know what? With this technique, you can have as many babies as you want.
So for people who want 6 babies, this is the secret.
Oh yes, it's like what your secret.
Yeah, she couldn't believe that she had given birth.
Yes.
Without feeling pain.
Yes.
What about like the nurses, the midwives that were helping you?
The same experience with them. Yes, because everyone wanted to. With my second child, they were there as the epidural was being placed, and everyone wanted to be around as I was giving birth. So
To see what happened.
yes,
Oh my goodness. And did you have anyone calling you weak or telling you you have chejo?
yes, a few relatives that got to know some. So some would be like, God created you, you're a woman, you're supposed to feel pain while giving birth. But I was like, no.
Modern medicine has come.
If there's an option for me to feel no pain, I'll definitely go for that. But of course, they were there.
So you do it again.
Definitely.
And your husband, what was his reaction being there, just seeing you lounging and seeing the baby coming? What was his reaction?
You know, I guess no one wants to see their spouse in pain.
Yeah. You feel like you missed something, like the screaming. You also
No.
want to know.
No, I don't want to know.
You don't want to know.
I don't.
Okay, thank you, Sandra, for sharing your experience. I'm definitely one transformed person as well, because I just keep watching epidurals in movies and it feels so foreign. But seeing that someone here who looks like me has given birth in a Ugandan hospital twice with an epidural and she's not lame. I've seen her babies are okay, they're not autistic. Like, it's incredible. Thank you for sharing. So I have another mom here with me to talk about her epidural experience. Hers is quite unique. First, she's an obs and gyn, meaning she's a gynecologist, right? And she is a mom of 3. She didn't get an epidural with her first 2, but got an epidural with her 3rd. So I want to ask, does she love the first 2 babies more than she loves the 3rd one for whom she didn't feel any pain? You can first introduce yourself and then...
Hi everyone, I'm Dr. Mary Awono and I am an obs-gyn in training. Yes, so like I can, let me go straight ahead and answer the question.
Yeah.
Of course, I love all my babies the same. If anything, no, but I love all of them the same. I love all of them the same. I love my boy, the one I had with the
no
epidural.
pain.
Yes, with no pain. Yes.
So since you're a doctor and you're in this exact profession of helping women give birth, did your fellow medical personnel look at you any way just because you didn't want to feel the labor pains?
No, so most of my colleagues were actually very excited because many of them hadn't really been there when someone was getting an epidural. Many of them hadn't seen. Personally, I had one. I had seen it once. One of my colleagues had gotten an accident, and so part of the pain medication we were using an epidural. So somehow how it's put, I was there for the entire process since I knew like I was next in line, and even any side effects she got and all that, I would actually be there administering for her the drugs because she had it for about 4 days. So I was excited. Then so the rest of my colleagues were also excited. They're like, we have to see. Mostly because they had never really seen it before and all from the places we've been practicing from. Yes. So, but there were maybe a few of the nurses who would be like, "Hey, are you sure? Like, you want to get an epidural?" Like they have, of course, with all these myths around. Some of them with small experience from different places. Maybe they have seen that a baby apparently got tired, and yet we don't do epidurals where we were. Yes, but I mean, many babies actually get tired even without the epidural.
Yeah.
So you can't say this caused that. Yes, but most of my colleagues were actually excited to like see. Yes.
Yeah.
Yeah.
So did you have any side effects? Backache, migraines, lame, or disabled?
Okay, so immediately they had given the epidural, like after the procedure, because I was able to walk, take selfies. I actually kept taking walks and all. But I think there's a point where they added the dose just a little, and then my legs felt a bit heavier, but I was still able to walk. Like I could feel them nicely. The back pain, no, I have zero back pain. I didn't get any back pain then, and I don't have any back pain now.
Did you have any side effects?
Yes, the main side effect I had was the itching, which is probably a side effect of the morphine that is given as a pain medication, but to last at least 24 hours. It's not that much, but it was there. Like it would come, especially after like some 6 hours, it would come and then go. It's a bit more like irritating, that itch, like you have to scratch, but then you could actually do without scratching. So that was the main side effects. Tried taking some medications to reduce it, but it didn't really. It just went away by itself. The medication didn't have any dramatic, taking it away. That's the main side effects I got, and then also another side effect I got was what we would medically call a neurogenic bladder, where you try to pee and you just can't pee. Like your bladder is full, you want to pee and you just can't pee. Yes, so that's the neurogenic bladder that I got. But that's a normal side effect, because even mothers who have undergone like a cesarean section using the spinal anesthesia, that's a known side effect, a neurogenic bladder. That's why usually they let them keep the catheter for 24 hours, such that by the time they are removing the catheter, that phase has passed. Yes, but now since I didn't have a catheter during my normal delivery, I actually felt that, but I still forced it out in the end. So yes.
So it wasn't debilitating.
No. It was just when I wanted to go, just once, and I felt, I was like, oh, so this is actually the neurogenic bladder. Like I actually felt it, but yes, nothing disturbing.
So were there any side effects on your baby?
No. My baby.
Tired? Did he cry immediately?
Yes. So my baby was born perfectly normal, perfectly healthy. So usually medically, when the baby is tired, they can maybe do some poop inside the water as well when they're still inside. And usually when we look at the water and it has changed color, that's when we'll be like, oh, the baby is tired, fetal distress. Or maybe the heart rate goes really high. So mine, when they ruptured the membranes, they were very clear, and they ruptured at the time when the baby was now coming out. Very clear, meaning the baby wasn't tired. It came out, cried immediately, and maybe the side effect is over breastfeeding, because he breastfed. Yes, he had an appetite anyhow. Yes, so but it was actually very, very fine and normal. Yes.
Was your labor with your third, for whom you got an epidural, longer than the first two labors?
No, it was actually shorter. It was actually shorter. Though I got the epidural when I was already in the active phase of labor after 4 centimeters.
That's the painful, the more painful one.
Yes. So usually, yes, the active phase, usually for the first 0 to 4 centimeters when it has just started, yes, the pain is there, but it gives you enough space in between.
Yeah.
Now active labor there, that one doesn't go. Like it's now, the pain is a bit more intense, and it's more intense and more painful. Yes. So, but my labor, I should say maybe it started like at 5 p.m. and 5 a.m. it was in the night. 6 is when it was a bit serious. So I gave birth, I think by midday. I got the epidural, like coming 8 something, coming to 9.
Imagine.
Yeah. So it didn't prolong it at all. Actually, my other labors had been longer, so it didn't prolong it in any way.
What was your thought process to getting an epidural? Since you had already done it twice, you knew what to expect during labor. What made you think of now getting an epidural for the third?
Okay, so of course the labor pains. The labor pains they are not nice, they are not fancy. Like they are not fancy. Like, so I don't know how God does it and we forget about the pain and want another baby.
Another miracle.
Yes, but that's really a big miracle. So, but personally, a colleague gave me the idea. I was like, would you want an epidural? And I was like, yes. So he told me, I have a colleague who can actually do for you an epidural, and he led me to Dr. Andrew. Yes. And somehow, I had so many questions for him because now being a guy and having all these other things are not really.
Yeah.
So I knew but what actually drove me is because in my practice, I know I'll have many mothers coming who actually want an epidural. Now, I don't want to be like everyone else who probably doesn't know and, just tells them, you know what, you need to puguma like this, and just because I don't actually have exact facts from experience to tell you about an epidural. So I wanted to go through it firsthand so that whenever someone comes, I know like for sure what I'm telling you. If they're telling me they are feeling this and all, I can give you advice based from a place of, experience. So that's what actually drove me. Of course, with all these other myths and all about epidurals, at some point, at first, of course, I was excited. I was like, okay, I'm going to be a guinea pig for this. But later, at some point I'll be like, but what if the baby, what if this? But of course I did a lot of reading. I would read like so much about like the epidurals, any side effects, all the studies, all all those studies, anything that has been done to try and get as much information about them as possible. Also, Dr. Andrew helps a lot in the information because now when we got talking, like he literally I asked him all the questions I had. So he took me through the procedure, everything, literally, yes. So I was much more confident, like, my decision after.
Why is it that many gynecologists are against epidurals? Like most of the gynecologists I've heard about will discourage you from getting an epidural, saying it prolongs labor or whatever other complications. Why are many gynecologists against it?
So the actual truth about, because I've also spoken to many like about it and their opinions, but the truth is actually it's not something we've been practicing much in most of our hospitals. Even like the specialized hospital, national referral, like that's where I had my delivery, but Dr. Andrew had to come in there, much as he wasn't working there, to offer it from there. So it's not something we've been.
You can actually have an anesthesiologist come in from outside.
Especially if coming from outside, because the most important person there is the anesthesiologist, the monitoring to make sure you're monitored, you're in safe hands, and in case of any complication, it can be managed like immediately. So the main reason most gynecologists discourage, it's really out of a place of ignorance, like and they want. In the end, you never want to put the patient in any harm. So if someone is not, if I've never really seen the procedure, I've never really studied and seen like exactly what happens, and maybe seen babies, the outcome of the babies, like by myself. And instead of telling you from hearsay and all, so most people will just discourage it because they haven't experienced like it where in the hospital is not routinely done. So others will give all sorts of like excuses generally, like there are bigger problems and all, but than pain. Like others have done it, labor is short and all. But that's the main reason. Yes, you can also do it. But the main reason is really it's not something routinely practiced. So many gynecologists are actually not exposed. So in the end, we fear. I wouldn't want to advise you for something which I'm not so sure about, and in case you get any complication, you'll be like, my guy told me. So that's the reason. And yet, pain has never really killed anyone also, like physically. True. So they are probably safer saying, go through the pain and like the baby will come out and all. Yeah, so I think that's the main
Would you
reason.
do it again?
Oh, definitely. For my other 3 kids, I can't imagine going through labor without an epidural. After seeing, I'm like, yes.
Thank you, Dr. Awuno, for sharing your experience. Honestly, hearing from other moms who have gone through it, now especially you who first had 2 babies before having an epidural and got an epidural with your third, it's honestly mind-boggling. I just might follow in your footsteps.
You definitely should. Those pains are not fancy.
Thank you for sharing your experience.
Welcome.
No, you guys, my mind has been completely open. I think this information needs to be shouted on the mountaintops. So where does someone get correct information about epidurals? Because there are so many myths that are flying around and they are being believed. I for one believe some of them. Like someone said, when you get an epidural, your labor will be lengthened. So where do we get the correct information about?
Like we said, we are anesthesiologists. We have an association. It's called the Association of Anesthesiologists of Uganda, and we are trying to be as more vocal about this as possible. And we are also changing the model. So initially, every mother that comes in labor goes and sees their obstetrician, and that's all they see until they actually deliver. So now we are usually in theatre and in ICU. So we are becoming more available at different hospitals in the outpatient department. You can actually go and ask to speak to an anesthesiologist who will tell you this information. Yes.
And there's also a website for AAU. We'll be trying to upload more information so that people can easily get the correct information about these things, so they don't stay alien and get all the really, really wrong stuff.
Another thing, we have a number of patients who have had successful epidurals.
I am going to show you one of them.
Who are actually out there spreading the word. So we slowly but surely will
Get the word out.
And I'm going to put the website link in my description. One last question. Usually when you give birth vaginally, there will either be an episiotomy or a tear. Can this epidural still help me, or I still have to get those shots for when they're repairing?
So what happens is, when you have a tear or an episiotomy, we simply leave the epidural medicine running for a bit longer while they repair. That way the physician can do a nice good job without you jumping. Yes. So the repair will be even better.
But there will be no
kicking
and all that.
Yes.
So now I think the question that's on everyone's mind is, how much does this thing cost? Does it cost an arm and a leg just so I don't scream? Just give me a range. Like 200K or
200K?
So there'll be different hospitals. They'll charge you differently, but you try to put it in a range. So if you go, we've tried to make it as accessible as possible, and also give room for us to prepare for these patients. So we'll tell you, if you've booked, you're a mother, say we run a clinic at the IHK, you've come in, we've had a chat, you've booked, then if it's the standard epidural, it's usually 1 million, right? Then if those emergencies will have to look for people, scramble for everything, then the price can go up, right? But I would say the range is usually from 1 million to about 1.5, depending on the
So you can actually save. You're pregnant for approximately 10 months.
You save
100K every month from the month that you're planning to conceive. By the time you give birth, you have the money.
Someone once said you can decide to do an epidural shower instead of private showers.
Instead of the baby shower.
By the way, that's an idea. If you don't want to stay during labor, just do an epidural shower. Everyone contributes some.
And you're good to go.
You're just a baby girl during labor. Thank you so much, Dr. Patience and Dr. Andrew.
You're welcome.
Honestly, my mind is open. I do not think I want to go through pain with this third baby. I'm going to talk to my gynecologist and try and change his mind. So that I'm just lounging and recording content during labor. Yeah, there you have it, guys. If you have any questions, please drop them in the comments below. I'm going to leave the link to AAU's website where you can get all this information. Let us not suffer in the 21st century. No more.
And thanks for having us.
You're welcome. Bye.
Bye.